Well, in yeah, I think it's time to get started, and I want to thank everybody for stopping by to another PI4D research spotlight. My name is Tommy Source. I'm Assistant Director of the Purdue Institute of Inflammation, Immunology, Infectious Disease. And we do this series to highlight different research that our members are doing within the Institute. And today I have the pleasure of inviting Anita Panjwani from Regan Bailey's group. And Anita has been studying the COVID-19 and food-related outcomes in children with autism spectrum disorder and the different disparities by income and food security status that exists within our communities related to that. And it's a very, obviously very relevant topic to be talking about as we are still uh, discussing and complaining about being stuck at home, doing these talks virtually rather than in person. But I'm so excited to have Anita here to tell us a little bit about her work and give us a little glimpse into the journey that she's taking in her research. So without further ado, Anita, take it away.
Great, thank you, Tommy. Good morning, everyone. Let's see if we can, maybe that's a little bit better. Okay. Good morning, everyone. Thank you, Tommy. Thank you all for joining me today. I will be presenting on my recent research, as Tommy mentioned, which was a joint collaboration between Dr. Regan Bailey and Dr. Bridget Kelleher's labs. So both in the nutrition science and psychological sciences departments. And my talk today will be on COVID-19, and food-related outcomes in children with ASD, and also highlighting some disparities by income and food security status. So for those of you in the audience who may not be as familiar with ASD or Autism Spectrum Disorder, I wanted to provide some background. And so ASD is a neurodevelopmental disorder, and it is complex in part due to its heterogeneous etiology, meaning it doesn't have a single known cause. And while genetics is known to play an important role, there are also many environmental factors that have been implicated. The current prevalence is about 1 in 54 children, or just around 2%. And the core characteristics as defined by the diagnostic manual are impaired social interaction and communication and restricted or repetitive behaviors and or interests. And the prevalence of ASD has been increasing over the past several decades. You can see here that this graph here actually ended right around 2009, and then I added that last bar in there to represent the current prevalence. So it's, almost doubled since the last 10 years there. It does have a high burden of disease, and this is not only shown in the individuals themselves, but also the caretakers and the families of the individuals, as well as having societal and economic impacts. There is no current cure. However, there are current therapies that exist, including drugs, behavioral therapy, which is the gold standard, and then also some other therapies, that have less evidence, and that includes dietary management as well. So in terms of the pandemic, previous research on crises such as the MERS epidemic has shown disproportionate negative effects on individuals with psychiatric and mental health disorders. It is also widely known that individuals with ASD prefer structured routines and they have specific preferences, and that extends to their food environment as well, in terms of what they're eating, where they're eating, how they're eating, and having their meals. And so disruptions, even minor ones, often lead to increased levels of stress and anxiety. And many individuals with ASD also have sensitivities to tastes, textures, smells, and appearance of foods, as well as dietary supplements. And a good percentage also follow specific or restricted diets. And so with all of this combined, these are large contributors to poor nutritional status that's often seen among children with ASD. And because of, partly because of this, they also have a disproportionately greater prevalence of obesity compared to their neurotypical counterparts. And so all of this combined, puts them at risk for early onset morbidities like chronic diseases such as diabetes, and obesity in childhood is, a predictor for obesity in adulthood and all the metabolic disorders that are associated with it. And also you'll notice real quick that I go back and forth here between talking about children with autism and individuals with autism. And I just want to make sure that I point out here that though this study focused on children, the pandemic had great effects on, individuals with autism across the lifespan. So I just wanted to point that out here. So the goals of my study were to describe the impact of the pandemic on overall behaviors of children with ASD, and then the food-related and eating behaviors of children with ASD, and then also to explore the role of, demographic, socioeconomic factors that may play, a role here in increasing the risk of these negative outcomes. So the study itself was a nationwide online survey of 200 parents and caregivers of children with ASD, serving as their proxies. And the children had a diagnosis of ASD, self-reported, and were under the age of 18 living in the United States. The survey dates included May through June of 2020. And this was a time, as you all know, when most states were under a shelter in place or a stay-at-home order. And we recruited mainly through the web, through social media outlets like Facebook, and offered remuneration in the form of a raffle for gift cards. So for a caregiver and household characteristics, we looked at US region, whether they were on shelter regulations or not, household members, education level of both the respondent and spouse or partner, if there was one, household income level, and then change in employment status. So either losing employment or reporting reduced pay. And this was for either caregiver or both caregivers. For child characteristics, we looked at sex, age, their age of ASD diagnosis, their race, their weight status. And so we asked for height and weight. And with that information, we calculated their BMI percentiles according to the CDC growth charts. And then we also asked about educational setting, because at that time, they were just starting virtual instruction. So another important variable that we looked at here was food security status. Food security, insecurity is an actual, risk factor for delayed development of growth and cognition in children. And it can also further impede, excuse me, the development of children with ASD and other developmental disorders as well. So we used a two-question method that was validated against the USDA Household Food Security Survey, which the two questions were: first, over the past year or 12 months prior to COVID-19, how often would you have thought the food that my household bought just didn't last and we didn't have money to get more? And then the second question was, how often would you have thought we can't afford to eat balanced meals? And then, so this was asked, of course, retrospectively. And then we also asked separately, how often do you currently think both of these questions? And so an affirmative response was recorded if the respondent replied with sometimes or often for either or both of the questions. And then it was a negative response that was recorded if they responded never to both questions. So our main outcomes were the impact on overall behavior, looking at none to small versus moderate to large. And the same was for eating behaviors. And then we also looked at difficulty in food availability, specifically in finding um, foods that the child preferred or usually ate. And additionally, we looked at food rigidity and specificity in the child's preferences and choices in foods, and whether they were on a special or restricted diet. Then after the onset of COVID-19, whether they had any changes in the overall amount of food ingestion, physical activity levels, and then for the family, the frequency of cooking or versus ordering out. So whether that increased or decreased. And then we also looked at the frequency of consumption of specific food groups in the children prior to and post onset of COVID-19. And so these were the frequency response options, and these were the actual food group options or categories that we looked at. And then we looked at these modeling these outcomes against these socioeconomic factors as well as shelter regulations. So household income, food security status, and then loss of employment. So now looking at the results for the main outcomes, the impact on overall behavior, close to 75% here, reported moderate to large impacts on their child's overall behavior post onset of COVID-19. And similarly, around 58% reported moderate to large impact on eating behaviors. And so I kind of wanted to weave in the discussion a little bit here since it's fresh in our minds. So there was a study from Italy that had just recently come out when I was working on this data that reported difficulties managing structured activities from the caregivers reporting this with families with children with ASD. And so the percentage there was 76%, which the question is worded a little bit differently, but it's similar to what we see for impact on overall behaviors. And again, here, a study from Portugal also reported 77% for worsened behavior problems. So it's interesting to see that the numbers here are similar across the world. However, for impact on eating behaviors, while we had around 58%, that same study from Italy reported greater difficulty in managing meals, which was their only sort of question on eating behaviors or food related outcomes, and that was 28%. So this could be, a large part due to the question and the way it's worded, but there's a big gap there that I wanted to point out. So it could be that families in the U.S. Are reporting greater impact on eating behaviors than in Italy. Okay. So descriptive characteristics for the caregiver and household. Shelter regulation, 77% families reported to be under some sort of shelter regulation by their governing bodies. 75% reported to be living with a spouse or partner. The average number of children under 18 in the household was 2. And the respondent education, you can see that just over 50% there had a college degree or above, and then another 40% had some college or associate's degree. And then looking at this by impact on the overall behavior of children, we can see here that shelter regulations actually did not have an association there, but we see that living with a spouse or partner was associated with the impact on overall behavior. And so there was a larger percent of children experiencing moderate to large impact on overall behavior among households where the respondent reported not living with a spouse or partner. Right. So, and then education and number of children were not significant. And then looking here at impact on eating behaviors, here we do see an impact in association by shelter regulations. And so those, who reported living under shelter regulations had a larger percentage of children experiencing moderate to large impact on overall behavior. And so that's what we sort of expected to see. But it's interesting that it was only seen on the impact of eating behaviors and not overall behaviors. So continuing here, now looking at more of the socioeconomic factors of household income, we see that the majority of families earned less than 50K, where about 21% earned 100K or more. Um, uh, Around 38% reported loss of employment or reduced pay for either or both caregivers. And food security, as I mentioned, was assessed prior to and post onset of COVID-19. So we have 55% of families reporting food insecurity status prior to, and then 60% reporting it post onset of the pandemic. And then here we find that there's an association with all of these characteristics with the impact on overall behavior in the ways, in the directions that we would anticipate, right? So it's interesting to see all of them were significant on the impact on overall behavior there. And you can see that for food security, that difference there um, was larger for post onset of COVID-19, right, compared to pre. And then moving into eating behaviors, here we only see that post onset COVID-19 food insecurity was significantly different here for impact on eating behaviors, which was around 69%. So similar in percentage there, but the p-values here for the rest of the characteristics, given the sample size, it's worth looking into further there in future studies. So here we have child characteristics. So 76%, around 3/4 were male, as we would expect due to sex differences that are observed in ASD. The average age of the child during the survey time was 7.7. The average age of their autism diagnosis was 3.7. And the majority of the children in our study were non-Hispanic white, with some representation of some of these other minority populations as well. So I just lay this all out together since there really was no difference here and no association for impact on any of the behaviors. However, I did want to point out this was, marginally significant here, which is the age of the diagnosis. And so you can see that almost, a year difference, so that children who were diagnosed at a later age at around mean of 4 years reported more moderate to large impacts on eating behaviors compared to those who were diagnosed at an earlier age. So that's something worthy to note there. And then continuing on for weight status, we see that 26% of the children were reported as obese. And this is actually compared to the CDC prevalence estimates from 2018 for obesity among all children in the US, and that was at 19%. Right, so as I mentioned earlier, obesity is disproportionately higher among children with ASD. And I was looking at reports earlier on just, pre-COVID rates of obesity among children with ASD, and it was, in the low 20s. And so this is, something that is worth, looking more at in terms of, did they gain more weight than their neurotypical counterparts during this time or not, right? So it's an interesting finding there. And then educational setting, around 63% were receiving virtual instruction at the time, whereas 30% reported no instruction. And so this actually included caregivers who reported that they had access to virtual instruction, but it wasn't working for their children. And so essentially, they weren't receiving any instruction at the time. And then another 7% were homeschooled. And then again, there was no difference, no association with the impact on any of these behaviors by weight status or educational setting.
Anita, was there any correlation, or did you look at any correlations between level of obesity and education level of the caregiver, and perhaps obesity level and homeschooling versus non homeschooling? Or I guess,
Yeah, I did not look at those. That's actually really interesting. I was just thinking of doing some more associations, with obesity now that I'm talking more about it. I think it would be really great to sort of look at that data a little bit more.
yeah, because I would think that, to a certain extent, the feeding habits, the eating habits are caused by the feeding habits of the caregiver as much as
Right.
the metabolism of the child.
Yeah, absolutely. Yeah, that's a great point. Thank you.
Thank you.
Mhm. Okay. Um, and then looking at the food characteristics of children with ASD, so these are defining characteristics, meaning just in general. So this was looking at food rigidity and specificity in their choices. And we see here that almost 95% reported some level of food rigidity in their children, with 40% reporting very food rigid or specific in their choices. And this was associated with impact on eating behaviors, as we would anticipate. However, special or restricted diet, while there were almost 80% they're reporting their children being on a special or restricted diet, this did not have any impact on eating behaviors. Then here we're looking at changes in behavior post onset of COVID-19. So looking at overall food intake here, which was associated with impact on eating behaviors. However, physical activity levels were not. But it's interesting to note here that we see both an increase and a decrease around the same percentage there, just around 40% for overall food intake. And then here for physical activity levels, we also see, though the percentage that reported decreased is a little bit higher at 54%, there was also a small percentage that reported an increase in physical activity. So this just, showcases the heterogeneity that I mentioned earlier in the etiology and the symptomology of ASD. I'm going to just start my laser pointer here so I can point. And then for one of our main outcomes was difficulty in finding foods. And so we see here that 65% of the caregivers did report that they did have difficulty in finding foods and that this was significantly associated with the impact on eating behaviors. Right, so there's the difference right there. And then we looked at frequency of ordering out and frequency of cooking. And again, we see here an inverse actually, where which was, as to be expected if caregivers are reporting an increase in cooking, and that's around the same percentage as a decrease in ordering out, right? But what's interesting here is that both of them were significant, but if we look at the numbers here for increase in cooking, those weren't really different by impact on eating behaviors, and same with the decrease in ordering out. What was significantly different, or what was different here, was if there was a decrease in cooking, frequency of cooking, and if there was an increase in ordering out. So that's where the difference is actually seen, which is interesting, and that's compared to no change here, right? And then this was actually a study that I just found that reported in the US, just in general, in the general population, frequency of ordering out and cooking. So I just wanted to kind of put that right next to these numbers here for you all to take a look at. So these are the percentages. And we can see here that for frequency of cooking, it's sort of similar here in terms of the numbers. However, the numbers are sort of disparate for ordering out. So just wanted to, point that out here, that may be um, just something worth exploring, but it's interesting to see what, like that there's a difference there, whereas in cooking there isn't. Okay. So now we're going into the logistic regression here. We did univariate analysis just because a lot of these variables were collinear. So shelter regulations, we saw no difference as we saw in the descriptive statistics for overall behavior. And again, here we're looking at moderate to large impact versus none to small. For food insecurity prior to COVID-19, we see a significant odds ratio here of 2.3. And then after the onset of COVID-19, it jumps to 3.8 and is highly significant there. Household income status was only significant with an odds ratio of 4 for those earning less than 50K compared to the reference here, which was 100K or over. And the middle income level here was not impacted. And then again, here, loss of employment was also statistically significant, again, with an odds ratio of 4 for overall behaviors. And then moving to eating behaviors, here we did see shelter regulations were significantly associated with the eating behaviors. And so we see the odds ratio here at 2.3. Food insecurity status prior to COVID-19 wasn't exactly, it was almost there, but not significant here. And then it was significant after COVID-19. And then here we again see that it's only the lowest income level that was significant with an odds ratio of 2.3. So, and then no difference for loss of employment, but I just wanted to go back and show you the difference in the odds ratios here. So it's a little bit of less of an impact for eating behaviors. However, when we look at food unavailability, we jump back to, the odds ratios of 4 here. We do see food insecurity status both prior to and post onset COVID-19. And then here, we see that both levels, lower levels of income, both under 50K and between 50K and 100K were affected at almost the same magnitude here. And then again here, no difference in loss of income. Okay. And then I quickly wanted to go into some of the specific behaviors. We were mostly looking at overall behaviors and the bigger picture, but we also did look at the specific behaviors among the children. So just wanted to show you this a little bit here, where the increased percentage is in the brown bars, and then the decreased is in the darker gray, while no change percentage is in the lighter gray. So you can see here that the distractibility, arguing, and stubbornness were around 70% there. And then hyperactivity, tantrums, disruptive sleep, crying, repetitive behaviors were all around 60%, clinginess, and so forth. And you can also see that there was a decrease in some of these, around 10%, right? So again, this heterogeneity of the way the symptomology and the presence of autism, it manifests. Okay, and then here I report looking at these specific behaviors by income and food insecurity. And so for this, we did a chi-squared test looking at increased versus no change and decreased combined by all 3 of the income categories here. And then of course by food security status, yes or no. And so we see that hyperactivity here tantrums, crying, repetitive behaviors, clinginess, aggressive behaviors, compulsive behaviors were all associated with both income and food security at a significant level. And then distractibility and arguing and stubbornness were only associated with income, whereas disrupted sleep, self-injurious behavior, and nightmares were only associated with food insecurity status. Um, and it's interesting to note here that disrupted sleep and nightmares, which kind of go hand in hand, are associated only with food insecurity. And we can only imagine, if families don't have enough to eat, children may be going to bed hungry, and that could be, one reason why they may have, greater levels of disrupted sleep and nightmares. And then I mentioned we looked at changes in the consumption of various food groups. So the frequency of consumption here. And I've highlighted the ones here that were significantly different prior to and post onset of COVID-19. And remember, this was all asked retrospectively. So we see the bars here before COVID-19 in the light shade of gray, and then after onset of COVID-19 in the black outlined boxes here. So we see that prior to COVID-19, they were eating more meat, right here, greater times a week or day. And then after COVID-19, that sort of shifted, the distribution shifted towards fewer servings per week, right? Same with seafood. In general, children with autism, tend not to eat a lot of seafood, but that's all of us as well, right? But here we see that the same trend of eating less seafood after the onset of COVID-19 was evident. Oops, sorry, computer froze a little. Okay. There we go. Okay. And then looking at changes in vegetable consumption and 100% fruit juice, we see the same trend again, where it was decreased after the onset of COVID-19. However, when we look at consumption of sweets, we see the opposite trend, right? Which we can all feel at this moment, where the consumption was a lot less prior to COVID-19 and greater after the onset. And this was actually highly significant there, right? So, gosh, my computer is not liking. Okay, there we go. Okay, and then this is the last sort of table that I wanted to show, which doesn't really have to do with the impact on the children's behaviors, but I thought it was important as context. And it's just all of these characteristics here by household income status, right? So as we would think, food insecurity status is associated in the direction that we would anticipate here. And difficulty finding preferred foods is also associated with household income level. But I wanted to point out here that loss of employment or reduced pay was reported among a greater percentage of those who were earning less than 50K prior to COVID-19. And so, this just made me, do a double take when I saw these numbers, because we see here that while 18% reported loss of employment among those who are earning 100K or less, that number is 57.5 here, so almost 58% among those earning less than 50K, right? So there's a huge disparity right off the bat, pre-COVID-19 income and whether or not they lost their job or had reduced pay after the pandemic hit, right? So, and we'll discuss that in just a little bit in the next slides. So to wrap up, looking at food availability, the previous research, shows that there are potential impacts of chronic exposure to reduced access to, less nutritious foods, reduced access and less nutritious foods, less expensive foods, and this has detrimental effects on, nutritional status in children in general. And so, even with the pandemic now, with children, as we saw, facing lower physical activity levels as well, altogether that can have further impacts and, lead to a risk of chronic diseases, which individuals with ASD are already at risk for. And then we looked at income level and food security status. And so previous studies showed that low income households without food insecurity status didn't actually have any difference for children having inattention or hyperactivity behaviors. However, when they looked at households that had both low income and food insecurity status, that was specifically related to or associated with adverse impacts on inattention and hyperactivity. Right, so there is a difference there, and we did witness that in the study as well. And so there are countless, papers on health disparities reported stemming from both low income and food insecurity status. And we see here and throughout the literature, over the past year that COVID-19 has amplified the differential impacts on families, with all the disparities that we see, not just health disparities, but, all sorts of disparities. And this is actually, in this study, we see greater burdens on the families with ASD, children with ASD. And we also saw in the results here that there was a greater magnitude of effect of food insecurity post onset of COVID-19 compared to pre COVID-19 levels of food insecurity. Right. And then coming back to what I was just mentioning about the percentage who lost employment, that was greater among those with lower income status. Right. So this just perpetuates those existing disparities. And as I mentioned, would have a, more likelihood to have a greater burden on ASD families there. So in general, there is a need for focus on just systems-based approaches, changes in policy, public health policies to sort of alleviate some of these issues of accessibility and affordability of nutritious foods, proper health care for these families and children, as in specific with autism-specific services. So I hope that gave a little bit of insight into the research that I've been doing. And thank you for joining in. And I would like to open it up for questions.
That's awesome. Thank you so much, Anita.
Sure.
Excellent presentation, excellent research, very thorough. I'll open it up to the audience who should be able to unmute themselves and ask questions if they have any. I see people unmuting themselves now,
Great.
so I'll let them interrupt me.
Anita, very nice.
Thank
A
you.
lot of information. A question about early in your talk, you noted that there was, I guess, 2 studies, one from Italy, one from Portugal, and that they aligned nicely on the overall behavior, but not, I guess, on the food.
Eating, yeah.
Yeah, eating. So my question is there a difference in food security? I mean, Europe is probably socialized, and I know in Canada they were giving supplements. So could that be a possible
I
reason?
think so. I think that's a great point. And I was thinking along the same lines, but I just haven't gotten around to looking into that specifically. But I feel like just with the knowledge that I have of, food systems here in the US and looking at other, European countries specifically, not anywhere around the world, but I feel like that could definitely be a factor that's, playing a role there. So that's actually a really good point. Yeah.
So Anita, this is Greg Knipp, and I did some work in this area many years ago at my previous institution, and I harkened back to some of the work from Van Cassel et al., as well as I had worked with some people in Italy.
Okay.
Yeah, Giuseppe Latini and Claudio De Felice. And one of the things that struck me, and one of our big interests, was we were seeing effects of certain endogenous chemicals on essential fatty acid homeostasis. And Van Cassel had reported a fair amount of disparities between the omega-3s, between even just autistic children contrasted with mentally impaired children, not even normal. We saw a very big disparity in a lot of the omega-3s. And so my question really is twofold. One, you discussed food insecurities, but I think part of what you're saying too is really that the food quality and the composition may be varied greatly. And the other part was that a lot of us felt that, and there was a lot of study for not all ASDs, but for certain phenotypes like Rett's, that fish oils actually tended to have a beneficial effect in correlation with outcome. And so my other question would be, have you ever thought about trying to go down a little bit further and look, and I know it's very hard from the studies you've done, but to really look at correlations between these different dietary constituents and your overall impact? I assume in COVID, we're not eating anywhere near the balanced diets, which I resemble that remark.
Right. Yeah, no, that's a great question. I love it. Regan and I have been actually working on some of the omega-3 fatty acid work. She's an expert on that. But I'm really interested in, the diet in autism itself. And I know, from previous research that I've looked at, you're right, it does have a differential impact on the symptomology of ASD as well. A lot of different studies have done sort of trials, and while the evidence isn't conclusive, there is sort of a general consensus that it could have, some sort of impact. I think it would be really interesting to look further into, this area of, if, they're taking what food groups they're intaking, specifically omega-3 fatty acid foods like fish, and also supplements, which a lot of children do take, especially with ASD. And we actually worked on a paper recently, just in general, with NHANES data that wasn't specific to autism, but we found that over the past decade or so, omega-3 fatty acid dietary supplement has been increasing among not just adults, but in children as well. I don't know, Regan, if you wanted to add anything to that.
Yeah, I was just going to say, mostly the literature suggests a beneficial effect of omega-3 supplementation, but it really depends on baseline diet. And you alluded to that in your comments. So people who are already sufficient in omega-3s, adding additional supplementation doesn't appear to be beneficial. But if an individual has low omega-3 status to begin with, then adding a supplement is beneficial. And that's where it becomes difficult to make recommendations writ large, or public health recommendations on whether or not to supplement, because we don't know what an individual's baseline status is.
Yeah, and I would just go one step further, that when we go with the omega-3s from fish oils, we're really looking at some EPA, but we're probably a little bit more DHA. And it's really the alpha-linolenic acid and the EPA that are really needed. I saw a great study from a colleague, Claudio De Felice, in Italy, basically reversing Rett syndrome in a child, or coming close to reversing it at the age of about 1.5 to 2 years old, with 3 months of just sufficient EPA supplementation. However, I have a good friend whose child is autistic, and they can't eat dairy and wheat. because there is all of these different phenotypes, and it is very difficult. But I have seen some positive results with the fish oil supplementation. I kind of wish I would have stayed in the area. I didn't when I moved here, but it was fascinating. Part of it was also everybody told me it was mercury and not plastics.
I was going to say a lot of the data come from fish and seafood consumption rather than omega-3s. And so the base of the literature suggests that fish and seafood consumption is beneficial. We as scientists want to boil that down to the least common denominator, which we assume is omega-3 fatty acids, but it could be something else in fish that's beneficial, or it could be fishes co-consumed with something else. It's just very difficult to disentangle these, but the supplementation studies have been equivocal for sure, and that's challenging.
I think the DHA link to myelin, sphingomyelin, is probably a bigger part, and I apologize for not monopolizing. Sorry, Tommy.
No, I was just going to say that probably from the background, it would be worthwhile taking a deeper inspection into that data from Portugal, where the culture is more of eating seafoods, is more those children are raised eating, bacalhau, which is cod. And that's like a staple. It's like, it's part of, and so maybe we can get tighter data to show the differences there, even compared to the Italian data, because those kids are not necessarily, they have more seafood than our American diet, but not as much as the Portuguese kids would. And again, I think there's a lot to be said about the caregivers and what they know or what they're feeding the kids, because I would think that autistic children are difficult to deal with as well for a caregiver, and maybe sometimes they give up by giving them a crutch of a cookie or a sugary treat or a drink, just so that they don't have to deal with the other behaviors that come along with a child with autism. And I wonder how much of the feeding and nutritional aspects that are being driven by the caregivers themselves as well.
Yeah, that's definitely a good point as well. So much more to learn here.
Absolutely. This is
Just to
great
say, you
work.
weren't monopolizing the conversation. We love talking about this, so we're so excited that
Yes.
anybody wants to talk about this. So
Yes,
we
Greg.
really appreciate the feedback, and we love talking about it, not monopolizing.
Absolutely.
Yeah, well, we were in New Jersey, and I was part of the childhood environmental exposure assessment, which was like the Mind Institute, and they focused on household chemicals, and that was it. And we're seeing clear links with phthalates and bisphenol A, and we lost the ability to explain it. Plus, nobody would fund us anymore because it was all the mercury, which was completely fallacious. So I still get upset because I'm seeing tons of this work now being reported with human placental and exposure, and it makes a lot of sense. But again, I have, people that have friends or friends that I have that have their son is almost perfectly normal. But if you give him an ice cream cone, self-injurious behavior, complete just remission, regression, doesn't want to be bothered. So it's very complex on the genetic level. Not all respond.
Absolutely. No one responds to the same thing the same way. Yeah.
Exactly. Anyway.
Yeah, no, I can see Bridget unmuting. Go ahead, Bridget.
I was just gonna to Tommy's point about the caregiver behavior too. One of the neat kind of outputs of Anita's project here is that we just yesterday submitted a big grant that links these types of assessment-based studies to treatment studies to help the caregivers too. So they're providing us with their data, and then folks in College of Ed here at Purdue are implementing behavioral treatments, and we can then link those data back to the assessment data to start to get at some of the functions of behavior and how these more complex kind of epidemiological questions trickle down into family homes and kind of complete that loop. I think what this conversation is getting at too is just some field gaps in terms of how we study these things, and we look for, you know, the one predictor, and we don't have all the other data we need to understand how that intersects with genetic subtype, or how that intersects with kind of family poverty or eating patterns in the parents. So Anita's study let us make the case that we're collecting the right data to get at these things. So hopefully you'll see more from this line of work soon.
Yeah, definitely. And sorry, I was just going to say that the big project that we're working on, Big Ideas Challenge,
A really good
is
job,
essentially
Anita.
that. Oh, thank you.
It was nice to see this all come together, and she's been able to submit 2 different publications on this. One is under review and one is under second review, I think. So people are interested in this work, and I think it's generated a lot of questions, and you know, we'll just keep chipping away at what we can.
Thank you all for such a great, you know, conversation. It was great to hear that all of you are interested in this work. So thank you so much.
Absolutely. And I really like how you opened up your talk with the international perspective, because I think we need to be eyes wide open to understand what's going on in other countries that are
Absolutely.
maybe dealing with this population a little bit better, more carefully than maybe what we are, and exchange some of those ideas. There's a lot about what you're doing that also, for me, has aspects of looking at the rurality of some of these families, how close they are to the cities, how close they are to those urbanized areas, or how far they are from, you know, care centers and centers where they can get some of these resources.
Absolutely. Yeah.
Very interesting work, Anita. You're opening up a Pandora's box here.
I hope so. That way, you know,
Yes.
we all have more work to do. But yeah, no, this is great. Thank you so much for the opportunity, and thank you all for joining us here. Any other comments or questions?
I think, Anita, there was a lag, and you're putting in a plug for the Big Ideas project. So I just wanted to mention that too.
Sure.
That Anita's kind of taking the lead on putting together the Pocket project that some of the folks on this call are involved with. But if you're not, the idea is to use nutritional assessments, link it to these other kind of predictors of outcomes, and to send these kits to family homes so that we can get more rich data from them. So if anybody wants to get involved in that project, which Anita's just done a phenomenal job leading, please do reach out. We have a big team of about 30 faculty at Purdue that are involved in that, and we're always welcoming more. So thank you.
That's great. Fantastic.
Thanks.
And thank you guys for providing this great work and spending time with us this morning to listen to this awesome talk. And thank you, Anita, for your great effort and your time to lead the way in this effort, and everybody else that
No,
took time
absolutely.
to join this.
Yeah, thank you both to Regan and Bridget for, you know, collaborating with me on this and, you know, bringing everything together. And it wouldn't have been possible without working with both of them. So thank you for opening up both of your labs.